Since the beginning of the COVID-19 pandemic, over 1.46 million people have died due to the virus worldwide. According to Our World data, the United States is responsible for over 266 of these confirmed deaths. Do you know what COVID-19 symptoms look like? They look like fever, chills, cough and or shortness of breath, fatigue, body aches, maybe even a headache, and definitely loss of taste and or smell. If you have experienced any of these symptoms, you may have been exposed to COVID-19 and you should get tested. Your next step would be to completely self-quarantine and isolate while you wait for your COVID-19 results. What type of citizen are you, may I ask? Has this worldwide pandemic changed the course of your life? Or are you living your life just like you did before the outbreak? If you're still going out for leisure, to party, and to hang out at clubs and bars, you are part of this worldwide problem that is causing us to lose people. Today, I'd like to discuss with you the 3 main points as to why we must continue to self-isolate and social distance. Continuing to live life as if nothing is going on is extremely dangerous due to the large amount of asymptomatic COVID-19 carriers, law-abiding citizens versus the rule breakers, and how the increasing risk and death toll numbers could be controlled with another lockdown of 4 to 6 weeks. To get started, let us talk about the asymptomatic COVID-19 carriers. Asymptomatic COVID-19 carriers are out there and could add an added risk. What does it mean to be asymptomatic? According to Gundersen Health, someone who is asymptomatic not only has the infection, but they are not presenting any symptoms and will not develop them later. There's also the high likelihood of someone exposing others to the virus because they are pre-symptomatic. Being pre-symptomatic means that they have the infection but don't have any symptoms yet. Why is this so dangerous? Going to restaurants, clubs, bars, parks, and even beaches allows people to touch and get infected just because you touch maybe the groceries at a store or even railings. Based on the CDC's conducted studies, COVID-19 is most commonly spread by the close contact between people, usually 6 feet or 2 arm lengths. Are respiratory droplets or small particles from an infected person's cough, breath, or even sneeze. It is easy to understand that we simply cannot prevent the spread if we are out in public. The only factor helping citizens run errands is wearing a protective mask like this one. Even the people that can wear them can still be exposed by touch or even by their eyes. Now that we have touched upon the asymptomatic carriers with COVID, let's divert our attention to the next point I want to make. Let us focus on the divide between law-abiding citizens and rule breakers. Hopkins Medicine states that thick woven and cotton masks are good protection. Blue hospital masks like this one and even an N95 are the best for safety. We can test this by spraying water on the inside of the mask and seeing how the spritz does not go through. I will be grabbing a bottle with alcohol and showing you this mask right here, and I'll be spraying it right here. You see how I'm spraying it and nothing's going through the front? Some is definitely dropping down, but that's because of gravity. But from here, nothing is going out, which means if we sneeze or cough, it will not transmit to others. Wearing this mask may save someone's life. The University of California, San Francisco conducted a research study named "Still Confused About Masks? Here's the science behind how face masks can prevent coronavirus." The study tells us that speaking is enough to expel virus-carrying droplets. Just carrying non-essential conversations out of isolation can literally expose someone to the virus. Health Affairs also conducted a research study where they found that masks mandated by the CDC led to a slowdown of the daily COVID-19 cases. Had the CDC put a mandate on wearing masks before in March, we could have saved thousands of lives. For those who are still skeptical about wearing masks, cold hard proof has been offered, and you are all just choosing to put the lives of others at risk because of your own ignorance. It is absurd that the others are working hard in their hard laboring jobs with masks, sweating, while these rule breakers refuse to wear a mask to Publix because they think this virus isn't real or because the virus or because the masks can save them. Isn't it crazy that there are facts about how wearing masks can save lives and people still refuse to wear them? This brings me to my last point. There is an increasing death toll in the United States, which can be controlled by a lockdown of 4 to 6 weeks that could help revive the economy as well. There has been a total of 6,277 new COVID-19 cases as of November 29th in the United States. These numbers are out of control when we have been dealing with this for almost a year now. Out of those 6,000 people, there have been 1,210 new deaths just today. President-elect Biden says that COVID-19 could be controlled with a lockdown of 4 to 6 weeks that would finally control the pandemic and possibly even help the economy. People are growing more and more tired of wearing masks and are circling back to their selfish behavior of not wearing them. Dr. Michael Osterholm believes that this is because the cold weather is coming closer and it is drawing more people inside to restaurants, resulting in more exposure and more cases. If the United States were to close for these weeks, the virus would be controlled. The lives of other people are not expendable. To sum up what we've discussed today, we have gone over the asymptomatic COVID-19 carriers, law-abiding citizens versus rule breakers, and how the increasing death toll numbers could be controlled with a lockdown of 4 to 6 weeks. We have all been affected by this virus in one way or another, whether it's with work, extracurriculars, or even school. It is extremely selfish for people to be parading around town while others are being safe and trying to protect not only themselves, but others. While closing the economy may be scary due to the loss of income, there is no monetary value that could be placed on the lives of others. Having fun at bars and restaurants is not worth losing people's lives. Our lives should be top priority, not our income. With everything currently going on in the world, I hope that you all consider the lives of others and continue to self-isolate or begin self-isolating and social distancing if you haven't been doing so already. I trust that you will all take the information that I have presented before you today and reconsider your stance if you're not being safe already. Thank you.